I have a number of patients who are enjoying life years after having a sudden death experience because they had the good fortune being near someone who could provide cardiopulmonary resuscitation, or CPR. Of course, there are times when people are certainly dying, when CPR would only cause more suffering and when resuscitation should not be done. That, however, is another story for another day. CPR is an emergency effort of chest compression, circulating blood, keeping the body alive, especially to the vulnerable brain, until the heart can be shocked back into a life-sustaining rhythm by a defibrillator. CPR is simply done by placing the heel of one hand on the chest, 2 inches up from the bottom of the breastplate, and with the help of the other hand, compressing the chest down 2 inches at a rate of 100 or more beats per minute. 1 and 2 and to the rate of the Bee Gees song, Staying Alive. That's it. Anyone can do it. Recently, we've learned that the most important component of CPR is the chest compression, and not the mouth-to-mouth breathing. In fact, studies show compression-only CPR by the lay public has a higher success rate than CPR with mouth-to-mouth. The exception is when halted breathing is the likely problem, such as drowning, drug overdose, or arrests in children. Most of the time, really, sudden death is due to a heart that is not beating at all or is beating way too fast. This, in turn, is due to many reasons, from a blockage of blood flow through coronary arteries, a weakened dilated heart, or even a baseball or hockey puck strike to the middle of the chest. Whatever the reason, 5 to 30% of those who receive CPR will survive, mostly without brain injury, because CPR tides them over until the electrical shock returns a life-sustaining rhythm. The sad news is that more than 50% of those people who could benefit will not have CPR because bystanders or family are afraid they might do something wrong, which is simply not true. The big mistake is not to start CPR. So if you come upon a situation where someone who might benefit from more years of life suddenly stops breathing and there's no pulse, then don't delay. 1 and 2 and staying alive.